Let's do a little short segment on periodontal disease. I'm sure you are very knowledgeable in that because we've covered it several times, but let's just do a little short segment on it since it's in our PowerPoint. So looking at healthy tissue, we know that we don't want periodontal pockets any more in the sulcus than 3 millimeters. And as you can see, here's your periodontal probe going into the sulcus, checking the pocket. So what should healthy tissue look like? We've talked about this earlier in the first recording. It should be pink. The gingiva should be healthy and pink. Healthy gingiva should have no bleeding when flossed, probed, or brushed. And of course, we want a small 1 to 3 millimeter sulcus present. So if anyone says, well, the reason I don't brush or maybe floss is because my gums bleed. The reason they bleed is because they're not healthy. So the more brushing and flossing they do, the healthier the gums will get and they will stop bleeding. So here's healthy tissue, and we looked at this extensively. I pointed out lots of things to you on the first video. So we're looking here at the periodontal probe, looking at the attached and unattached gingiva. This looks a little red, but it's just the picture. So the tissue should be pink and healthy looking. So the first problem with not having healthy gingiva, you go from healthy gingiva to gingivitis. And of course we have the itis on the end of this, so that means inflammation. So gingivitis can be very easily reversed. It's just an inflammation of the gingiva. And as you can see, there is no pocket. Okay, so the periodontal probe is still at normal, but we're starting to see some inflammation in this tissue. So all it takes to reverse gingivitis is some good home care, brushing techniques that we've taught you in lab, flossing once every day, and then, possibly some type of rinse. Brushing alone will not do it. Rinsing alone will not do it. We have to get that floss in there, and we have to floss properly. Okay, so gingivitis. In the gingivitis, you collect bacterial plaque. So plaque is the problem. It's not being removed from the teeth every 24 hours. The gingival crest becomes inflamed. If we look back at this, you will see this is what we're talking about, the gingival crest. The tissue bleeds easily, and it's the beginning of periodontal pockets. So it starts at gingivitis, and how fast it progresses is different with different people, but we definitely want to get that gingivitis stopped so that it doesn't go into a periodontal problem. So treatment, scaling, polishing, improved oral hygiene. If there's calculus present on the teeth, then it doesn't matter how much brushing or flossing you do, that calculus is still there. So we definitely need to have a hygienist or a dentist to scale the teeth and polish them and get all of that calculus and plaque off, and then we can start fresh with our home care. Okay, so here's an image of gingivitis. The first thing you start noticing is this little red area. I kind of call it mooning. So this is the red moon around the tissue. This is the way gingivitis starts. And here we have some gingivitis, red, puffy, swollen. So inflammation, this is inflammation, and there's bacteria there. And that bacteria is just going to continue to cause more inflammation. The more inflammation that occurs, the less home care you're getting, and so the more bacteria is going to collect. So if the gingivitis is not corrected, then it will go eventually into moderate periodontitis. So this is, again, moderate, but yet if you look at the periodontal probe, you see the depth that you're getting to now. Okay, so we had 3 millimeters, and now we're up to 6 millimeters. So here we have calculus, probably some stain. So that has to be removed in order for a person to continue to clean the teeth. Now, once these pockets are here, they do not completely reverse, although medication can be put in there to help reduce it and shrink it. Once it's there, we'll always have to be diligent in the cleaning. So moderate periodontitis. So plaque accumulates, it begins to calcify, which causes calculus. Some people call it tartar. It's all the same thing. It causes the surface to be rough, which irritates the bone. Then the gingiva recedes, and then the bone breaks down. The teeth get loose, and then you have your problem with the tissue and with the teeth. So all of this is occurring when these pockets are forming. So how is it treated? A hygienist or a dentist would have to do deep scaling. Okay, that includes root planing and polishing, and then home care. But the bone loss will always be present. Let me go back to that picture again here. So in other words, this would have to be scaled off and cleaned. Then the patient would have to brush and floss. We could try to reduce this pocket, but somewhat of that pocket will always be there. So it would have to be cleaned more often, have to be sure that the person's doing good home care. We can't reverse it, but we can keep it where it's at. So moderate periodontitis. And of course here we just have a periodontal probe. This is called the sulcus. So the periodontal probe is inserted into the sulcus to see the depth of any pocket. And I know all of you know what a periodontal probe is. Okay, localized pockets. This is where a person may have one area or two areas in the mouth where they have some pocketing at. If you look at this, as you can tell, this tissue here is real red and swollen. So for whatever reason, maybe this person has a problem with the tissue around this tooth, but yet maybe all the other teeth are okay. So we can have localized pockets in different areas of the mouth. Pocket depth is the key. That's why the hygienist or the dentist has to use a periodontal probe. Remember, a dental assistant cannot use a periodontal probe to probe pockets. That is not within our scope of training. So you look at the measurements on the periodontal probe, and that's how they're measured. Obviously, if this probe were inside this pocket and it came down this deep, obviously you would have bone loss and the tooth would be very mobile. But anyway, it's showing you the depth. All right, so looking at moderate periodontitis, it can go from small pocketing to very extreme. If you look at these teeth, we see calculus, we know bone loss is going on, we have gingival recession. Here, if we look between the teeth, you can see where the teeth has tartar and calculus on them. So that all that needs to be scaled off. When you see this dark coloring, you can see this here. This is calculus. So that needs to be removed in order for the patient to keep it clean. This is after the teeth have been cleaned, they've been scaled, and everything is brought back to health, although it is not reversed. So you can see here, yes, this tissue is healthier. Yes, the calculus is gone, but this bone will not grow back. So this is the tongue sticking through there. Okay, so this is where the gum, the bone should be. So you see the bone loss in this area. You can also see gingival recession here in this area. Again, yes, this is much healthier. This is much better, but we cannot reverse it and make it all go away. Now, these teeth will eventually be lost. There's very little bone there. But if they can stay in for a year, 2 years, 3, then the patient gets that much use out of them. So this is moderate periodontitis post-op. Patient like this would have to see a periodontist, not just a general dentist. So advanced periodontitis, which this is not too far from that, but not quite into it yet. So advanced periodontitis, again, look at the calculus, staining on the calculus, the pocket depth. So you only have this much bone holding the tooth in place, and you already have inflammation this far down. Okay, so this is advanced periodontitis. Significant bone loss, bleeding, pus, and halitosis. Periodontal halitosis is a smell on the breath that is very different from any other breath. Halitosis has a bacteria smell It has a very strong odor. It is very offensive. It's not like not brushing the teeth of a morning, or having morning breath, or having onions on your breath. It is a very, very offensive breath. And once you get out and you realize the odor that this gives off, you're going to realize how offensive it is. But it, because of the bleeding and the pus, you have the halitosis and the calculus, and it's just a mess. So within advanced periodontitis, of course, the teeth are going to get loose and they're going to eventually fall out. I have actually seen teeth with advanced periodontitis that a dentist actually extracted with a pair of cotton pliers. So that's how, all that's holding it in is a little tissue. There's no bone left. Okay, so this is some advanced periodontitis. Obviously, you see how the teeth are drifting, and that would take nothing to remove those teeth. So this is what happens when people do not visit the dentist to have the teeth cleaned. They do not do home care. Now, this isn't going to happen overnight. Some people it can happen in just a few years, and other people it may take several years to happen. But it will happen. There's no if it will happen. It will advance to this. Okay, let's stop this section here and we'll pick up again in another section.